So today we're going to touch on topics of mental illness, health concerns, health access challenges, which is a real serious problem in North Carolina in that the governor decided that we would not be part of the president's health care plan. Weight management for those that need to address that. As well, we've got handouts, booklets on just about every topic that we are going to be talking about. So if you don't have a question here, I think the information that we're providing is going to be real good for you at a later date. We're also going to talk about maintaining mental health to avert hospitalization, as well the concerns for the youth. For these young folks now being of the illusion that they can set themselves on fire and it not do irreparable damage to them, that is beyond me. I can't comprehend that. And for the parents, in one or two instances, to have videotaped that, that's nothing short of negligence. That parent, in my mind, needs to be put up beside the tree, get a belt, and beat them. Don't beat the child. So the child, at this point, if the mom of them hasn't got a sense, you can't expect anything to fall from the tree if the tree is barren. So we'll go ahead and begin. Our guest today is Tammy Ford. She's a registered nurse, as well as MHA Rural Health Nurse Educator. And we also have Ronnie Glover, who is a licensed clinical social worker. So with that, two things as far as housekeeping. The three of us are affiliated with the VA. There will not be a discussion about the VA and anything that pertains to the VA, if we will. That's a topic that we ain't gonna discuss. Just call that what it is. Get that out now, and then we don't have to worry about it in the event somebody has a question. Take it to the governor. Your senator, your congressman, but not here. Okay, with that being said, Mr. Glover.
Hello everybody, I'm Ronnie Glover. I'm a licensed clinical social worker at the VA. My social work experience started in Child Protective Services at Iredell County DSS. I was an investigator, and I did that for a little under a year. From there I moved on to mental health case management with Piedmont Behavioral Health, now Cardinal Innovations. And I was there for a couple of years. From Piedmont Behavioral Health, I worked at Nazareth Children's Home. Started out as a residential case manager for their level 1 home. After I got my grad degree, I started as a program manager. And also I worked as a therapist in the day treatment program, and also with some of the children on the verge of going back to their family. So I worked sort of to get those kids prepared and get the moms prepared as well. The moms and dads prepared to have them back into the home. Currently I'm working at the VA as a licensed clinical social worker in their NICM program. That stands for Mental Health Intensive Case Management. This is a program for veterans with severe mental illness, schizophrenia, schizoaffective disorder, and major depressive disorder with some psychosis. And to tell you how I like it is, I don't have a skill, but I gave you a list of my experiences, so I think it's best if you have any questions for me, I'll go from there. I'll try to answer them the best I can. Yes, sir.
I have a family member who has been diagnosed as schizoaffective disorder. Prescribed medication and given another men treatment. And not compliant. And does not, behavior is both mentally ill and he doesn't show signs of being dangerous. Trying to avoid the involuntary commitment. Here's my question is, do you have any suggestions of how I might be able to urge him to, and let me be a little bit more specific. withdraw, isolates, one of them in this room, several hours a day. And the question is, what can I do to sort of get him off?
That's kind of a hard question, and I really don't know the ins and outs. But I think the first thing I would do is figure out how involved you are with your son's care. You know, and maybe you, your son, and his prescribing doctor could meet and find out why. You know, what's his reasons for not taking his medication? Maybe he doesn't. You know, maybe he's having a hard time dealing with side effects. You know, that would be probably the first place to start. And and this is, you know, I'm speculating, but if he's got a medication regimen that he can tolerate, and then encourage, you know, some sort of more social interaction, whether it be at a day program, that'd probably be the best place to start. I know one here in town, it's the Carter House on N Street, or something similar to that. But I think the first place to start is why, you know, figure out why they take his medication, you know, and probably even link it into a therapist. That, you know, that's, you know, based on information that you gave me, that's how I would handle it. Thank you very much.
Quick question, and
I did have my hand raised.
I don't know what you guys said.
Anyways, I was asking, this sheet is helpful. It talks about educators should know the warning signs for mental health problems. Can you give some insight on the warning signs of mental health issues versus kids just being undisciplined or bad?
Mental health issues, the only way I think you could really figure it out is to have them evaluated. You know, it's what's going on. Is there rule violations? You know, is it, you know, that's something that a lot of parents face. Is it just being rebellious that you see when kids go to adolescence, or is it something a little bit more? I would say, you know, isolating is one thing, you know, but just rule breaking, that's something that still could be addressed with mental health counseling, whether it's a distinct diagnosis or just somebody who needed some guidance, and perhaps even bringing the parent into that therapy as well. You know, sometimes parents don't have all the answers, and maybe someone on the outside could provide some insight and some guidance into getting things right, and it could be something that's that just needs to be recalibrated, or, you know, with an evaluation by a mental health clinician, you could see that there is something that's actually there. So that's.
What would be, this says know the warning signs. What would be warning signs that might indicate that it is something of a mental health disorder?
I would have to see this kid. You know, the first place I would say is the children that I work with that come to see me, problems in school. If a kid was a decent student and didn't have any issues at one point, and then you see a noticeable drop off in behavior, academic performance, that's a warning sign. If a child that was, you know, that behavior was manageable, and you see a drop off, that would be warning signs that there's something going on, at least something, you know, that you would want to investigate and look at and have that clarified. But those are the warning signs that I think of when a person, that's just not children, but anybody, when you see distinct changes, you know, those are warning signs.
oh, I'm sorry.
Yes, sir.
What I needed was, or wanted was, maybe a more basic definition when you talk about mental health. When I think of mental health, and maybe most people, maybe extreme cases, schizophrenia, you know, things like that. And then the second part is, I know that there is a hesitancy in the Black community to, engage in practices to deal with mental health. And just maybe from your opinion, why is that, and what can we do? So two different questions.
I don't think it's just the Black community, but it's the community at large. These things are there's stigma associated with mental health. What we can do is to erase that stigma. We don't get mad at people who have diabetes, or we don't put down on people who have hypertension. We get those matters addressed. Mental health is health, so we need to look at it that way. It's part. Our mental health is part of our greater health, and we just need to look at it that way. I don't know if that answers your question.
Well, and I guess just a deeper understanding, because again, I think you tend to focus just on one thing, maybe because of the outward signs you see. But I know with Robin Williams, recent suicide, depression has become, a lot bigger. Are there more variations, or is it all kind of interrelated?
You mean depression?
As far as just when you talk about mental health, are there different avenues?
Mental health is varied. There's substance abuse. That's a part of mental health. There's depressive disorders, and then there's the psychotic disorders. I guess it just goes back to what I said. It's a part of our greater health. It's not just these are things that need addressing. It's like physical injuries. When I think of people who are experiencing psychosis, that's a medical emergency. Because the longer a person stays in a psychotic state, the harder it is for them to ever return to baseline. So I'm saying that these things need to be not to be poo-pooed or say he'll get over it. Get past it, whether it's bereavement, whether it's depression, whether it's even ADHD. These are things. These are matters that need to be addressed. And I don't know how everybody feels about medication, but at least go to a competent, mental health professional and be put on the road to get that matter addressed.
So do you think that is medication always the answer?
That's what I'm not saying. For some of the more severe, maybe yes, sir, yes. Before something like opposition refined disorder or ADHD, there's some restructuring that can be done in the house, and incorporating the parents to address these things and get them at least the first as your first place of trying, getting these things back on track. ADHD setting limits, getting a calm, quiet place where a kid can study. There are some cases that are worse than others, and medication may be indicated, but that's a place. That's a starting place. Making the study area conducive for concentration and doing work, taking away screens, iPods, iPads, and limiting time on those things.
How can we get it, especially to the Black community? How many Robin Williams are going to have to do things before it's realized that it is a serious problem? You can now, okay, the teachers do a fantastic job in school of finding the kids with a problem. I'm old school adult, where they don't believe in mental illness. And I can say that there is such a thing. And they want to say you're crazy, you need to be locked up. You don't need medication. How can we get this to the older generation to come down to the younger generation that it is a serious problem?
person to person. You believe it, you know that it's real. As far as you understand that mental illness is a real thing, and I'm sure there are other people here who say the same thing. You just got to talk to your church family, your community, and there's information out there. There's information that's probably going to be provided today. So I don't, it's a personal thing. It's something that you do one-to-one. I don't even like to use Robin Williams, as an example.
Yeah,
Because the same day that he died, there was countless folks that committed suicide, and we don't even know their names.
But it was brought to everybody's attention. There's
Yes, sir.
Yes, Dr. Comment. The loss of a job really is a loss to mental health. Okay? I traveled to Cherryville, Charlotte, Hickory, Colorado. See, and so you're talking about structural problems, socioeconomic disintegration leads to individual disintegration. Okay? During the Great Depression, people committed suicide, etc. Okay? And so, even with medication, see, those fundamental, those structural problems are not really being dealt with. If there's something positive to come out of Ferguson, it has to do with the fact that after 47 years, people are still looking at structural inequities, okay, that affect a lot of people, if I make sense. See, inside of that context, that I don't know if you really are in a position to, solve these issues.
And I'm right. That's way above my pay grade. But they're real.
Yeah, and so you have a progenitor of these problems, and you can hire 1,000 sociologists. See, but the generator of the problem is not really being dealt with. See, and so the system benefits on both ends. They generate the problems through structural inequity, but they also benefit by offering fake remedial efforts in solving these problems. And thus they persist over and over and over and over again. That's it. And you cannot discuss this with comment. Our mental health is also dealing with the dynamic and the reality of white supremacy. We're talking about the politics of skin color and the politics of hair. I don't mean to speak disparagingly toward the white people who are here, but obviously they can mitigate it by developing an awareness, just like I can mitigate it by developing a high level of awareness. See, my cousin Johnny was treated differently than me, my grandmother, because I'm the right color. Okay? But he's dark, with gold teeth. Those to me, yeah. So, we have got to deal with, I'll say it, you don't have to deal with VA. You don't have to deal with them at all. Racism and mental health. There are people who are being demeaned and mistreated on their job every day. I said this back in the day. I'll be all these girls. I don't give a damn. See? But at some point in time, this has to be addressed if we are really serious. Other problems will continue to persist. Now, we Christians, above and beyond everybody else, have the empirical standard to measure the validity of these approaches. We can take an empirical approach. And that is, we must do what? Measure the tree by what? The fruit it bears. And if it bears bitter fruit, it doesn't bear any fruit at all, it's but fit to be what? If you would die. See? I'm going to shut the hell up for now. Racism and mental health and the structural issues of the context, two of the contexts. Out of this context, this functionality occurs. Because see, as far as I'm concerned, just what it does, all right? If we are normal within the context of how the European psychiatry defines normality, we're probably out of our goddamn minds, you know, to begin with. See, we don't know what it's like not to be in a colonial state. We don't even have a baseline of what normalcy is, because we don't know what it's like not to be here in this place, victimized by racism, white supremacist bombardment. What does that look like as a baseline of normalcy? See, I can be adjusted, but adjusted to what? Sickness, which means I'm probably straight. Don't tell me.
Okay.
I'm a Floridian, and so
Oh, God.
I'm sorry, I love them.
Oh.
I learned a lot. And with that being said, I understand that mental illness can be hereditary, especially like schizophrenia and ADHD and stuff like that. But what I want to know is, when do we use the herbs that are already here to treat these problems?
That's a question that I can't answer. You know, you talking about an alternative medicine, Eastern medicine. You know, that's out of my civil practice.
So no one's talking about it?
Not where I work. You know, I know that, you know, North Carolina has thousands of years of tradition of Eastern medicine and alternative medicine, but I can't speak on it.
But medicine is ranking and spirit, peace, love, you know, so you know I love you, right? You see, but even the relationship between the mother and the child is adversely affected, okay, by the adverse situation that the mother encounters in a social-political system, okay?
I just want to piggyback on something that Willie is saying. And it's
Russ.
I'm sorry.
Yeah.
I'm sorry.
Just don't call me Tom.
You said Willie, I accepted that as being
That's all right.
factual. But you know, neglect and abuse and poverty, you know, these things do impact brain development.
Yeah,
So when you see a kid who's wide open, or a kid that has that watchful, hypervigilant, stare, you know, those things are a product of trauma, abuse, neglect, not being deprived. So those things are, you know, what you're saying is valid. You know, so how do we address these things? You know,
I would just like to add, and there are also environmental influences as well. And oftentimes what we see in mental health, we see parents pushing their children towards assistance. And a lot of times it's the parents that we need to actually have in horrendous services to. But oftentimes the child is seen as a symptom of pain when the problem may actually be a result of the dynamics in the family. So when you think about, you know, servicing a child or referring a child, also consider referring the whole family in order to really eradicate this.
Ronnie, on top of that, can you talk a little bit about the trauma work that's going on out there?
well, one of the agencies that I work for, and I'm not a trauma clinician, but that's the focus is going on trauma and addressing, you know, not just the symptoms, but the source, you know, and whether that's witnessing domestic violence, whether that's being sexually abused or physically abused, you know, because these things drive behavior. So that's you know, that's a new focus, trauma focused cognitive behavioral therapy. Is one approach. I don't think we do it with kids prolonged exposure therapy where it's almost an immersion type therapy where you're almost under the guidance of a clinician. You're put back into it. You're made to relive that experience, and until it sort of loses its power. Positive reprocessing. I think that's something we're using with a lot of our vets who are coming back and you know have PTSD. So addressing that trauma is you know, we're kind of behind the curve, but we're starting to consider that, you know, instead of this kid is, you know, he won't take a shower, or he won't take, he or she won't undress, because, you know, you're thinking that kid is just being defiant when actually, you know, that bath time is when that child was abused. Yeah. And so they're just protecting themselves. They're going and, you know, protecting themselves. Nazareth, it's adopted the sanctuary model, which is a model of care, and that starts from the CEO on down to you know, the direct care staff, where they're considering, and they consider, and they're working to mitigate, you know, re-traumatization, you know, because, you know, some of the things that we take as just, you know, being kind or putting your arm around a kid, you know, it creeps them out, you know. So.
First, I'd like to apologize for arriving late. But what I like to say, I like to address the question that you have. Professionally, I am a pharmacist, and I'm a pharmacist for the Lutheran Services for the Aged. Even though I deal with a geriatric population, I have noticed a shift from traditional medications to alternatives, to the point where we have had to establish relationships and rapport with health food stores, whole food stores, because we've been unable to get the herbal supplements from traditional resources that we normally receive our medications from. So to answer your question, my side of the profession, I do see a shift, and people are more apt and more engaging to consider and take that into consideration and consider that as an alternative. And a lot of the patients are requesting it, because most of the medications aren't intended for long-term use. But, right, and the side effects are worse than, you know, I'm killing my own profession. But the side effects are worse than the symptoms they're supposed to resolve. So I see a lot of physicians geared more towards that because of that. So maybe it just hasn't reached this population. I'm assuming we talk about a younger population. Maybe it just hasn't reached that population yet, but there is a shift.
I think you also see other treatment modalities as far as alternatives like with the biofeedback, guided imagery, more group settings where people explore their feelings. And I think that tends to help our body in some of the mental health arenas, because there is such a stigma associated with medication.
I always want to talk about the solution. So I was thinking more like exercise and reading and herbs and stuff like that.
You will find it, and this is my experience in health, there is no set protocol that's going to be the cure-all for everybody. So different things are going to work for different strokes. I think he was saying the same thing in the roundabout. Different strokes for different folks. The key is exploring what works for you.
far as exercise, I listened to a show called The People's Pharmacy, and I think last year there was some research. I don't know where it is right now that said that aerobic exercise, cardio exercise, did have a favorable impact on depression.
There's a lot of data on that exercise, especially aerobics, training, and things like that, where they get these beta endorphins going and stuff for a period of time, tend to lift people's moods up. Now, not everybody. Now, there's some people who have sort of like maybe a psychotic-based depression, but the average everyday depressed person who goes through a lot of rumination and all that sort of stuff, they can lift their mood. They can change that rumination over time. Exercise has been shown to be like one of the better ones. Certain kinds of relaxation protocols also help as well. Icing somebody's face tends to help with anxiety spurts and that sort of thing. But there's been a lot of data that's come out of the New England Journal of Medicine that showed that a lot of the depressive medications had a little better effect than for the average person. I'm not talking about people with psychotic depressions. Has a better effect. It has the same effect as the what do they call that? Placebo. Mm-hmm. Correct. Placebo effect. And actually, they were outstripped by things like cognitive behavioral therapy, exercise, which we mentioned, and those sorts of things. Just wanted to throw that in.
Over short at midnight. Okay. In case Timmy drinks orange juice, okay, nothing happens. Timmy is one of about 12 personalities. Okay. Same body, different personalities. Split personalities are a common characteristic of abused children. Okay. Split personalities. Okay. Yes, sir. When one of the other personalities, Timmy breaks out into hives. Okay? So for each different personality, you have a different physiology. And associated with each physiology, you have a different immune system. Each personality has its own disease disorder. We're talking about psychosomatic illness now. Okay, so you get kids coming out of Duke, North Carolina, Colorado, FAMU, who insist that, okay, illness is caused by some type of bacterial infusion or some type of viral syndrome. But see, what I'm submitting is that illness is also caused by the type of personality or consciousness that we have allowed to enter into our bodies and our minds. Okay? And thus we're talking about a change of consciousness that has the potential, to at least mediate some of these psychological problems as well as the disease that a person may encounter.
You say interesting, you talk about the kind of music you listen to.
Well,
those kind of
yes, sir. In fact, see, because the content, a destructive content, is carried through one of the mediums, such as music. And if you look at the culturally based content of how it changes, when people were talking about MF the Police, how that content was removed, versus, calling sisters B-words and all kinds of derogatory kinds of information, that's put out there on the radio or in mass media. See, what kind of cultural content are we being fed? Okay, that also has an adverse effect not only on our altered state, like the movie, but also on our ability to at least ward off some of these diseases. I'm just making a comment. You know, I think these are variables, along with what everybody else has said. If we are talking about cures, if we are talking about cures, self-hatred is a disease. And then what are the correlating effects based on that type of consciousness in and of itself? Because if I internalize this, see, this is going to have an adverse effect on my internal makeup. The type of consciousness affects my internal makeup.
I have a question, if I may. It was about non-prescribed herbs. Definitely treating psychotic depression.
For me,
Yeah. Anything that works.
that I know works for post-traumatic stress disorder. Eucalyptus, and please forgive me,
Right.
cannabis sativa.
Oh, my son been doing that. That's been part of the problem.
Medication, that's different.
Yes.
This is for occasional use only.
Oh, okay.
Strong medicine.
I'm gonna take that one home.
And music and water. For me, with post-traumatic stress disorder, it does it every time. Like soft music, water running, the sound, it takes the edge off real quick. That's something that you burn or boil just for the aroma.
Maybe more of a statement than a question, but it kind of speaks to what Willie was saying about cultural awareness, but I think there's a lack of understanding and awareness. And what triggered that, I watched the video from the recent shooting in St. Louis, and clearly, and I think it was said in the video, this young man suffered from some type of mental instability or mental health concern. And it sounds like to me we put an inordinate amount of attention on outcomes more so than really understanding that prevention. And, you know, even with the police department, and I worked in law enforcement early on years ago, and I can recall so many of these young people being on Thorazine and some of these other, you know, drugs. And the attitude was keep them comfortable with these medications as opposed to putting some type of interventions or anything, awareness or education, even for the officers that were dealing with them. So, you know, how do we strike a balance between just keeping people overly medicated, having harsh realities like what happened with him being shot down in the street, and that awareness and understanding? And I think it gets us almost to a frustration level for a lot of people, and I think that's what's seeping out now. But I think mental health just doesn't get the equitable amount of attention and understanding and cultural understanding. So,
And this is not an indictment for any of these brothers and sisters, but that's not what this institution is designed to do. You know, it's like the family, education, religion. You know, I'm just making a comment. No indictment here. All designed to maintain the status quo. Yeah, well, I'll deal with him in a second here. But they are all designed, I mean, the rulers of this society are not going to permit any institution unless it supports the status quo. To the degree that Christianity supports the status quo, within Christianity will be adopted as the official Roman religion. When you have a contrary narrative coming from the Christian adherents, well, they're going to be thrown to the lions. See? Because their narrative doesn't reflect maintenance of the status quo. That's what I'm saying. But back to what Mr. Harden was saying, what we talking about the family, the composition of the family being destroyed. We talking about reactionary masculinity. See, something that the chamber can do, along with the literacy initiative. We talking about confused sexual identities. We talking about peer pressure. You know, and just a plethora of things, you know, that result in this combustion. Okay. Along with a general attitude of just a lot of brothers have just given up on America. You know, riots become the language of the unheard. Thus, you get a group of people, individually or collectively, who are trying to make visible their invisibility. But, you know, we probably hadn't even scratched the surface with all of the preventative techniques and methods that Ken is talking about. But what ticks me off, and I'm through with it after this, is that standard psychology, standard mental health, okay, offers the perspective that it wells up from some type of individual genetic defect. Okay, and that's the kind of thing that we have to be cognizant of, because then, you know, you're going to have less remedial efforts because you just have these natural inclinations based on some type of biological defect. And that's what you get, especially when you're dealing with institutions that are inherently racist.
I also wanted to make a statement about the hereditary part. A lot of times when we talk about suicide, a lot of times people that commit suicide are bipolar or post-traumatic or something that most people wouldn't recognize. My father committed suicide when I was 14. And later in life, we found out that he was bipolar. And we started doing family research. That's why I know so much about my history. We found that the man, John Adams Rankin, was from Ireland. He was crazy. And he ended up being my great-grandmother's father. And so it didn't come from my actual, like, bloodline. It came from the Scotch-Irish bloodline. But because it integrated with my family, it showed up in the DNA. And so how do we approach that? Because with me, I'm learning daily with a son who has been diagnosed schizophrenic. And then I've been working with a group of girls for since 2011, and they all have something going on, whether it's low self-esteem or a little bipolar disorder or a little manic depressive. How do we get past the problem to the solution?
You know, that's a complicated question, and I'm sure I have an answer to it. You know, I would say a level of watchfulness and vigilance, and that's the only thing I can really even say. And I say that because my father also committed suicide, and I saw some of the behaviors, but I didn't understand it. You know, I didn't. You know, my dad was a reckless guy, and I just assumed that he'd just be wild. You know, so when he started to, and I didn't know at the time, when he started becoming suicidal, I just didn't know what the deal was. I mean, I didn't have any education about it. I assumed that he was. I didn't know. Truthfully, I didn't know. I think about it sometimes. I look back and say, okay, when he went and did this, that was a warning sign. That was a cry for help. He didn't get it. You know. Now I have that. You know, I have that knowledge, and I can intervene. But you know, I didn't know. So I'm saying, I'll say, educate yourself. Know what the signs are. When people tell you they're going to hurt themselves, believe it till you just prove it otherwise. You know.
So, working in the football field, piggybacking on what Mr. Hart said and the lady said, the problem I see with mental health is over-medicating. We deal with children. We get them in as young as 5 years old. And when they're 5, how can you medicate them to as their zombie form? You're not working on the problem. You're not getting to the root of the problem if we giving them these medications and they just zombified just to keep them from going off, spitting, hitting, or whatever. That's the solution. Let's give them this medicine. Let's calm them down and keep them calm, and we don't have to deal with it. Then, as like she was saying, family. The whole family needs to be involved. That's something I would like to see working in the group home field. The family needs to take the therapy also because it's a simple fact. We send them home on them weekends. They come back. Mama done let one girl go call the chat line. She's 13. She's sleeping with grown men all weekend long, doing what she wanted to, taking care of herself. So when she come back to us, now we gotta go through all this all over again, get her back trained on what a proper young lady does. We can't even take this girl out in public to the mall or nothing because she's propositioning men all the time. I mean, we have a day program. At the day program, we have locked doors with codes. Now, certain people can know each code because she goes out, say she got to use the bathroom, but she's done proposition or seen a man that was going in the unemployment office in the other building. She's trying to get back to him. I mean, she's straight out like, you want to F me or let me S yo, you know what, and F your girl. They could be walking with their wives, whatever. She'll start a fight with them. She don't care. We have to pick and choose with men working in the homes also because now we have cameras set up. Well, we have to have a camera on her door at all times, and if you're watching her, we have to sit outside the door. This is not a jail, but this is how we have to do it with her because she's done made allegations after allegations, and she's done took her clothes off for the male staff and come out. Now we got to restrain her and try to take her down and get her back in the room and cover her up. But she's getting mad at the females. And then the family's not helping us out.
Your next, I just want to say, I think Mr. Harden talked about how to, I mean, it's what's important to us as a society. You know, what do we want to put up? What do we want to spend our money on? I mean, it's easy to hire more policemen. It's easy to build new jails. That's an easy fix. You know, you know, are you gonna train policemen? Are they gonna get this information? Are they gonna get this information on mental illness? Or are people gonna continue to have to go to Rowan Regional and you know, when you're trying to get somebody an evaluation and they're there for 8-9 hours? You know, are we gonna invest in a mental health triage so people don't have to, you know, people don't want to take, I mean, I've done this, and nobody wants to go to the emergency room and sit from 7 o'clock in the day to 4 o'clock in the morning. You know, you'll say, I just won't go. You know, so I mean, are we going to get some? Is mental health triage a solution? Are policemen going to get mental health training? Are we willing to put money on these things? Are we going to make sure that there's mental health professionals who are knowledgeable and trained in you know, in spotting and addressing trauma? This young lady's gone through some sexual trauma. This isn't just you know, just her libido's out of control. This is she's been traumatized sexually. So you know, it's something that I can't answer, but you know, it's something that I would hope that our politicians and policymakers would see it's important. I don't think it will be, but you know, it's where we need to go. Yes, ma'am.
My question is directed to you. I've obviously shown this traumatized scenario. She's in your care. She goes home for the weekend. She comes back. She's with you all week or whatever. What type of intervention is it? She get any type of counseling, or she? So
She cusses out the counseling.
This is not helping.
No.
So,
As of right now,
that's
nothing, we just have her. And my boss has cried out to the social workers, her little team and all that. We have meetings now every Tuesday with them, like, nothing's helping.
But she's never been committed like to an institution that deals with that. So,
She's done been up there, but we kicked her out. Nobody else wanted her. The family don't want her, but the family want to tell us what to do with
how
her.
old she
She's
said
13.
and then kicking her out, then surely.
They
have
said
a
it's a
very
certain time.
professional-
It's a certain time you can stay up there. See, that's the thing
That's-
with
that's-
the
that's the
institutions,
problem.
it's a
That's the
certain
problem.
time.
You know, you got a time where you can only stay with.
Right.
See, that's where we're wrong. That's where it is.
There's no other people to take her, so we took her because we don't have a time limit.
So who change your handle? Who do we reach out to maybe address that issue of institutions here in the timeline?
Well, the problem is they try to close us down anyway. So it's kind of hard to go through this fight because they want to shut down the group homes. They said, basically, we're no good. They want to shut the group homes down. We have level 3s. If you let go of them level 3s, we are in the world of problems.
To answer your question, my son is in a level 3 right now, and with him, we are trying to eliminate the group home life because Medicaid doesn't want to keep the group homes open. It's real difficult when you don't have the finances to keep something like that going. So what we need to do is we need to go to the people who fight to keep stuff like that open and plead and sign some petitions and pick it, I don't know, but somehow get the funds.
Well, are these people legislature, private businesses, I mean, what do you think?
Well, for me, it's the Department of Social Services because they're the Medicaid providers. So when they're withdrawing their funds from the group homes, then what you don't have the help in the, like she said, the mental institutions is usually 2 weeks to maybe 2 months, and then they're done with it. So
We can fight all we want, but until we get help from legislation and all that.
I am totally ignorant, but who funds Butler? Is that a state hospital, or what is it?
I'm not sure who calls
So
it.
that means those funds come from the state, so we need to get for legislature to get.
Right. That's the main thing, it's lighting the fire with legislation, but it's legislation that want to close us down.
I just wanted to add that, I guess about 10 years ago, we had an influx of group homes in the state of North Carolina. The state was really concerned that this was considered an easy business for people that weren't in behavioral health and did not have backgrounds in behavioral health. And as a result, the state shut many of these homes down. I would say at least 75% have closed. Kids in level 3 group homes, I think there's a reimbursement rate of $200 and some odd a day. That's very expensive type of care. So of course, if the state can eliminate that and replace it with a lower type of care, like outpatient therapy, something like that, of course they are. And so I think that's what has happened. But initially, there were many people taking advantage of the system, and they had these businesses, and they were making a lot of money.
Yeah, you have some that don't care, and you have some that do care. So it's making it hard for the ones that do care and that's trying to reach those children because, I mean, they're young kids. How could you not have a heart to see a 5 or 7-year-old come in and you wondering exactly how bad are those problems that mom and daddy couldn't handle it at home? And then you got mom and daddy wanting to come in and question you on what you're doing and all this is right. So it's like, all around the board, it's hard, but you still got to do it. And that's why I say with this field, you have to have a heart to do it because you're taking a lot. And you don't get paid a lot, so you're taking a lot. But I just don't agree with the medication because how can we reach them? How can we work with them when they're medicated? When I take them out to the park, you too medicated to even want to run around, to even want to play. I wouldn't even put you on a swing and push you because you might fall off. And then now I got to do the paperwork for that. And I'm being under investigation, so it's kind of hard. And you can't skip doses because that's neglect, that's abuse.
most facilities like that have a pharmacy representative. You can correct me if I'm wrong. They have some type of pharmacy representative that goes in, usually about every 3 months to look at reduction of the medication and trying to look at alternatives. It used to be that it was the go. I don't want to even say it was the goal, that people were over medicated to excess. And in some cases they still are. But medicine is changing now, that they're looking at alternative medicine, they're trying to reduce medicine because we realize that medicine is not the cure-all. It's not the cure-all.
I wanted to say one thing. I don't know if anybody made this statement, but I did hear somebody ask the question about the Black community. And what I will say is shame, secrecy, and denial will keep you sicker than your own mental illness. And with saying that, I can freely tell people that I have post-traumatic stress disorder, but it is well managed. Sometimes somebody can scratch a little too deep and I'll cut their head off. But 9 times out of 10, it's managed by my diet. I'm a vegetarian. By my herbal maintenance, and by helping other people, reaching outside of myself, So I have my program, and I think it's up to the individual to actually be taught how to come up with their own program of what's going to help them manage their illness. But they first have to stop being secretive and ashamed and living in denial, and that's what hurts the Black community the most when it comes to mental illness.
And what she's introducing is that we got to get rid of that stigma within our community when it comes to mental health, because there is a stigma. Because everybody wouldn't feel as comfortable as she has felt in this room to share, what her illness is.
Free.
But everybody's not free, right? And the reason why they're not free is because there's a stigma. Because they're afraid they're going to be looked upon differently. People are going to respond to them differently, react to them differently. They may be cut off, whatever. But there's still that stigma we need to dismantle within our community. And I think I may be talking about when I say this, but I think the African American Church is one of the biggest contributors to that stigma. And we need to accept some accountability for creating that stigma, for our people not feeling comfortable in the skin that they're in, and knowing that it's okay. So y'all can talk about it, but we gotta stop this.
But young lady, you talked about being comfortable with the skin that you're in. There's no greater sin than to hate your own skin. But now, where's that coming from? Where's the self-hate coming from, Doctor? Ma'am?
Deep down inside.
I guess for people who aren't confident in
You how you was taught, how you been raised.
There's nothing wrong with it.
I mean,
You just crazy, go somewhere and sit down.
in elementary school, did we not get run, spot, and run?
No, we too old for that.
Okay, Heckle and Jekyll.
Yeah.
Did we not get religious imagery of God being a white man? Okay. Did we not get imagery of Miss America? Where does the inferiority complex come from? Is the white supremacist bombardment real? That denigrates black beauty, black hair, black intelligence, black capacity, black hair texture, darker hue. Is that not real? My pet peeve with the churches, they don't discuss these issues.
Everybody's equal to them.
Equal to,
They perceive everybody as equal. You worship God, you're equal. There is no light, dark, good, bad. Worship the Lord.
and I can respect that in a religious situation. But a religious situation, a religious reality is not a social reality. In spirit and peace, love and soul, sister. And man lives in two dimensions. Time as well as in eternity. And an adequately trained preacher deals with both. And see, and I say all that to say, purpose my comment, spirit of love and peace, that you cannot deal with the virtues of heaven without dealing with the social, political, economic conditions that make life on earth a living hell. Hell is a condition.
But, Russell, I like to say that the Anglo-Saxons have nothing to do with me jumping because somebody slams a door. The Anglo-Saxon has nothing to do with me having nightmares in the middle of the night because somebody was shooting over my head. The Anglo-Saxon has nothing to do with the fact that I fear men because I was molested. The Anglo-Saxon has nothing to do with that. Those were black people, all of them. Those were black people shooting. Those were black people slamming doors. Those were black people hanging me out windows. Anglo-Saxons weren't there. Now, their mental conditioning might have come from something that an Anglo-Saxon did to them. What I'm saying is, can we get past the problem to the solution? We need to find solutions and give it to our children as soon as possible.
And we're going to deal with that, Ms. Record. But I'm saying, okay, Jabbo down in Charlotte, 3 9mm, one in his sock, one in his coat pocket, one in his waistband, down Betty's for road, pow, pow, pow. See? I see you Thursday on the 8th floor in Charlotte, in your best hairdo, orange jumpsuit, telling this white woman judge, yes, you are. Say, Jabba, why didn't you do that last Friday? See, why did the same respect you given here, you giving it on Betty's Ford Road?
Because she got the power to give him time.
You know what power is. He knows what power is, you fool. See, so I'm still talking about it goes back to the dyad of power. It goes back to the power dyad. See? Disproportionately, we're talking about power. See? Power being what, in the chamber, or is it in the American Enterprise Institute? Power in the chamber, or is it downtown in the police? Power in the chamber, or is that the Hoover Foundation? Where is power? What do you know, why must I denigrate you as a woman? Would I do that to Miss Sally Swansonberg? Probably not, because of my conditioning. You know, when I disrespect the sister, we had this conversation earlier. See? That's part of the sickness. See? You know, I mean, you can't. Mrs. Swiller, you wouldn't have done that to me if I was light-skinned, did that to your life. It's your behavior. Nothing to do with you.
I don't know.
See? I'm talking about a behavioral modification technique that is the most awesome ever.
Okay, if we could, we may have to go back to this.
We gonna have to, sure.
This is one of those conversations where, okay, we could be here for a while. But again, we got to start talking about ways to correct things and get this information out in the community.
Next session.
To get folks educated. I'm one of those ones, if you know better, you'll do better. I also agree that the churches need to participate in this. That's one of those far-off dreams, but to me it's obtainable. You gotta look me in the face and say no, but then you have to expect what I'm gonna say when you say no. So these churches, I'm gonna have some communications with them just out of curiosity, just as well as you can say, if I do wrong, I'm going to hell. If you ain't doing right, where you going? When you leave the flock.
The blood is on their hands.
That's right.
So that conversation.